May is Mental Health Awareness Month, and with people enduring over a year of sheltering in place due to the pandemic and dealing with uncertainty and loss, many are struggling with anxiety and depression. And although vaccines are now available, possibly providing a light at the end of the tunnel for some, many are still anxious about returning back to normalcy. And joining us to discuss different ways to overcome these issues, please welcome Montefiore Medical Center's Chief of Psychology in the Department of Psychiatry. Please welcome Dr. Simon Rego. Hello, Dr. Simon Rego.
Hi, thank you so much for having me, and thank you so much for casting a spotlight on mental health issues in the month of May. I really appreciate it.
Although in reality, we've been enduring quite some mental cases for over a year, as I opened up with. And I think it's important for us to have this conversation, and thank you for taking the time to share it with our audience. Just at the beginning, like what would you figure, or what would you consider symptoms of either having depression or suffering from depression or suffering from anxiety, not having been clinically diagnosed?
Well, the trick too, as you've hinted at, is we should take a step back first and just recognize the year we've all had. And particularly here in the Bronx, it has been such a challenging year for so many people that we don't want to pathologize or make every symptom of anxiety or depression a diagnosis. Right? It would be, in fact, normal for most people to have some symptoms of stress, anxiety, depression, associated emotions, given it's been such a hard time. So it's not like you're either normal and don't have any of this stuff, and then you've got some sort of mental illness and you have this stuff. Most of us are on a spectrum where we have most of this stuff anyway in little bits and pieces, and then to get diagnosed, it's when it reaches a certain level what we can talk about. So I just want to be clear, though, to experience some anxiety or depression or other emotions that are challenging in the past year, that given what we've had, would be perfectly normal. And in fact, you would expect most people to have some of those.
And so what could a person do to, okay, let's say on a mild spectrum level of recognizing that some of these symptoms are part of our everyday, what could a person do to overcome it? Is it something that can be holistically healed?
Yeah, I think there's lots of things that people can do to keep it in check when it's not necessarily at a level that we would diagnose as having a psychological disorder. Right? To be clear, there are times when it does become a psychological disorder, and even those are quite common now. There was a recent poll done by the American Psychiatric Association where roughly half of parents polled believe that their child's mental health was in question in the past year with symptoms of depression and anxiety. It was just about 50%. So there are a certain level of people that will reach a problematic level, but even that's relatively normal, and it would be perfectly fine to then seek help. If it's becoming a level of distress where you're finding it difficult to function, either in your job, in your social life, in your home responsibilities, or you're having thoughts about life not worth living or suicide, then this is beyond when we'd want to do minimal level approaches, and that's when it's a good sign to try to reach out and get help. But
so I'm sorry, I was just going to ask, so when you say not being able to function, can you elaborate a little further on that?
Yeah, for example, like when moving from sadness and the blues and then grief, which a lot of people have experienced as normal in the past year, it tips into what we might classify as a clinical depression or what we call major depressive episode, when people have felt several symptoms in our diagnostic book, like low energy and trouble concentrating and excessive feelings of guilt or worthlessness and trouble with their sleep and change in their appetite, and they're no longer interested in doing things. And these happen most of the day, most nearly every day, for at least a couple of weeks, often longer. Then the same people might say that now I'm late for work, or now I'm not showing up at work and I'm getting written up by my boss, or now I'm noticing that I'm not addressing my bills, and now that I'm behind on my bills, or now I'm not cooking for my kids, or I'm not cooking for my partner, or people are noticing that I seem much more withdrawn and I'm not socializing as much, and people are saying, "Are you okay?" Those are all signs that it's tipping into something more significant, that you might be good to reach out and get help from a professional.
And so let's say, yeah, a mild case of that exists, and one is aware that there's a shift. Um, what would you recommend that they do? Is it a matter of speaking to someone? Is it a matter of writing it, journaling it? Is it a matter of just communicating what's being stored internally?
You should be a psychologist, because you just hit on three of the things that all three of those ideas sound wonderful. There's a healing that comes when you connect with social supports. So the inclination often when we're anxious and depressed is to withdraw and isolate. And so if you can act in contradiction to that, and actually, despite what your mind might be telling you, reach out to people, and it often helps sort of share the burden we're feeling, and knowing other people are going through similar things gives us some validation that we're not alone in the world. So that's a great idea. And then journaling is a way of taking what's inside of your mind that's potentially causing you distress. The thoughts we have sometimes get quite extreme when we're feeling anxious or depressed. So to put them out in front of you is a way to examine them and look at them differently, and almost get them out of our system, as is talking things through, because we know the more people suppress and hold things in, the more it plays a long-term, potentially problematic role in our lives. It might help us today, but long-term, the stuff we hold inside ends up working against us.
And so now on the flip side, right, here we are about to reopen at 100% capacity, and some people are vaccinated and some people are not. And so now there's this other mindset that one has to, I guess, recondition into coming from a place of isolation to now being in crowded places and being unsure as to whether this person's vaccinated. It's just a lot to like digest, right? So how do you feel, or what would you recommend that people should really prepare themselves with to cope with the, I guess, what we would consider the new norm?
Yeah, exactly. And we don't even know exactly what the new norm is yet. It's changing still. We get new guidance from the Center for Disease Control every little while. So the CDC gives new guidelines, and we then try to adjust to them. And there's still quite a bit of trepidation and uncertainty in the air. So there's some things you can do. Right? The first thing I would say is regardless of what the guidelines are saying, you can still control the pace at which you do things. You can make decisions for yourself based on your own unique personal circumstances, your own medical issues, your own life circumstances, to control the pace at which you do things. You don't have to go from isolation to a crowded place in one jump. You can take nice progressive sequential steps, dabble a little bit, put your toe out there in a way that feels manageable, push yourself a bit, because we know whenever people have been out of the rhythm of doing things, including going out again into public, initially when we start to do things we haven't been doing for a while, it's quite natural to get anxious. It's just the way the body is saying, oh, this is unfamiliar to us. So, and then given what we've faced in the past year, there's still a sense of threat out there because we saw a lot of horrible things happen to our loved ones. So our brain starts to tell us, be careful, be careful, be careful. So we want to follow the latest guidelines and know what has been suggested as safe, take our own personal circumstances into consideration, and then take productive action. Like, you could still wear a mask even if people don't have to wear masks. You can still follow the guidelines about trying to social distance, trying to stay outdoors initially as you get more comfortable, wash your hands frequently. So you can still, there's no rule saying you shouldn't take the precautions, it's just they're loosening them a little bit.
I think the key word that you placed in your suggestion is pace. I think at the end of the day, it's really a matter of finding that ease and grace in the choices and the new norm, because it just keeps changing so so frequently that it's kind of like, okay, we do this. No, okay, don't do that. Do this. And at the end of the day, we all just, we want to go back to normal.
Yeah, and the question is, what will the new normal be? And when do we reach that point? And along the way, it will challenge us to tolerate uncertainty, because what's behind a lot of anxiety is people look at uncertainty and they see threat in uncertainty. I don't know if it's safe, so my brain says, well, you better play it safe than sorry, and you feel anxious. But the thing to remember is we tolerate a lot of uncertainty every day anyway. We tolerate uncertainty when we drive our cars. We tolerate uncertainty when we go for a walk. So we just have to get used to where's the realistic threats out there? How can I take productive action to cope with them, and then gradually extend our lives back into the world again at a pace that meets our own individual circumstances.
Wonderful. Thank you so much for all the advice, Dr. Simon Rego, who is the Medical Center's Chief, Montefiore's Medical Center's Chief of Psychology in the Department of Psychiatry. And for you guys, for more on mental health resources, you can visit montefiore.org/psychiatry. And for behavioral health for kids and adults, you can visit montefiore.org/BHIP. And we did mention it, but there's a beautiful project going on called the Crane Project that you can participate in as a means of healing together with community. And for that, you can visit covidcraneproject.squarespace.com. All right, we have to take a quick break, but when we return, we're going to continue discussing mental health.